Medicine Grand Rounds, and it's our Laura Mann Integrated Health Endowed Lectureship today as well, which is really always a special Grand Rounds. And I'm going to let Dr. Kara, not doctor, could be a doctor for all the you do around here, Kara Feldman Hunt from the Osher Center will do our introductions. Thanks, Kara.
Thank you so much, Dr. Calkins. Welcome, everybody. I'm Kara Feldman Hunt. I'm the Associate Director of the Osher Center for Integrative Health at the University of Vermont. And as Dr. Calkins said, this is a Laura Mann Integrative Healthcare lecture. I love to honor Laura. She was a visionary. She was diagnosed with stage 4 breast cancer, and she really learned to thrive with a whole health approach. She was the first person to really open up an integrative health center in our area. And in 2015, after Laura passed, we merged with UVM, and we are now the Osher Center. And now it is my pleasure to introduce a dear friend and colleague, Dr. Sian Cotton. Dr. Cotton is a licensed clinical psychologist. She's the founding director of the Osher Center for Integrative Health and Turner Farm Foundation Chair at the University of Cincinnati College of Medicine. She's a professor in the departments of family and community medicine. Dr. Cotton has an active research lab with ongoing clinical studies focusing primarily on mindfulness-based interventions and integrative medicine practice-based research. Dr. Cotton is currently the vice chair of the Academic Consortium of Integrative Medicine and Health, and soon to be our new chair. And I have the honor of serving on the board with her. She is an absolute leader in the field of integrative and whole person health and an Osher Center cousin. And our team is always learning from her wisdom and creativity. So we welcome you, Dr. Cotton, and you can take it away.
Thank you, Kara. What a kind introduction. Good morning, everyone. And particularly given the snow, the late night Oscars, and the time change, I'm impressed to see so many people here with us this morning. It's my privilege and really my honor to honor Laura Mann. Is it Laura Mann? Is her last name correct?
That's right. Yep.
Make sure I get it right. So really an honor for me today. So let me make sure. Can folks see this, Kara?
Yes, you look perfect.
Great. So good morning. Hopefully people have a cup of coffee or tea with them. I hope to speak to something that is, I think, relevant for all of us. I'm somebody who really likes questions throughout and absolutely would love to be interrupted throughout this. We can always send slides. So please either unmute and just ask me a question, put it in the chat, and I think either Lisa or Kara will be watching that for us. So my hope, let's see, my first hope is there you go. My hope is to talk a little bit, not too much, about the drivers of burnout in healthcare and sort of our landscape of stress, and really talk about the impact of chronic stress on well-being, both for ourselves, our community members, our patients, our learners, to talk a little bit about the science behind the evidence for the use of mindfulness and mind-body techniques in particular, knowing that I'm speaking to a family medicine audience. These are not new concepts for you, but I hope to present some things today that may be helpful in our thinking. And then, as always, to practice some things. And so there'll be an invitation at some point to put your phones down or your emails if you've been pulled into those, which is easy to do on Zoom, as we know, and to just do some practice this morning for your own well-being. So I won't paint the picture too much because I'd like to get to the fun things, but we all know that stress is a major issue in the World Health Organization actually dubbed stress the health epidemic of the 21st century. And this was pre-pandemic, but, sometimes people say to me, stress, Sian, what about, the opioid crisis? What about pain? What about diabetes, obesity, all of our conditions that we work with every day? And as you all know, stress and inflammation are really at the core and underlying all of these things. And then came COVID, and none of us needs to really be reminded, but I think about it as almost a dial. So it was already very, very stressful. You look at our global picture and you look at many of the inequities that were really amplified, and it's as if the dial just went forward. And so many of us in our communities know that this is the reality. So I don't know if people can see this picture on the right. What the hell is that? Oh, that's just my mind. Sorry to curse already, Kara. But, you know, if you look at these words, overloaded, distracted, connect, does anyone on the call ever, I wouldn't say feel like this. Is there a time when you don't feel like this? Hopefully there is, but we're kind of on the go all of the time. And it's just constant. And this is the world that we live within. And so I don't mean to joke about it, but this is one that says, what seems to be the problem, Mrs. Johnson? And she says, I feel the way that you look. So in addition to just general stress of the world and the global landscape that we live within, the issues in healthcare we know are real issues. Some of you probably know this data a little bit more than others, but probably won't be surprised that 1 in 2 physicians experience burnout. This is from Tate Shanafelt, and the numbers have stayed similar. And it's not just our physicians, right? It's our APPs, it's our frontline MAs, our PSRs. It's really people that work within this space, which is a very intense space with increasing expectations and certainly resources that are not expanding, that are often limiting. And so I always wonder if people wonder where their own specialty is. So I did go ahead and put family medicine is right up there, right? So this is from 2024 Medscape, and family medicine, not surprisingly, fits that same landscape of kind of 1 and 2. And so sometimes, when we think about this, I'd have you think not only about your own well-being and where you are personally, but also colleagues around you every day, and even sort of your national colleagues and what we can do together. So people often say to me, can you really define burnout, Sean? Well, psychologists and many of us in medicine can define anything we want, right? So Christina Maslach is the research psychologist who really put together the Maslach burnout inventory, which, as you read papers on burnout, the MBI is the one that is most often used. And the way she talked about is that burnout is a response to stress, not an acute stress, but a chronic stress that wears on you so much over time that you don't even really know it's there, because it sort of builds and builds and builds and builds. So not an acute event. And the 3 sub areas, again, invitation just to think about your own well-being and others, the 3 sort of sub areas within the measurement. One is emotional exhaustion. So you get to the end of your week, maybe your day, maybe your month, and you just kind of have nothing left in the tank, right? You've given everything you can. The second is depersonalization, which we certainly see in our learners earlier and earlier, I think, where we sort of depersonalize a patient, a situation. People become numbers instead of people. And then a low sense of personal accomplishment is the third kind of definition of burnout. And that's, anyone on this call, if we were to look at our CVs and what we've done in our life, people would be like, wow, what an accomplishment that any of you have done. But we tend to feel sometimes people that are experiencing burnout tend to say to themselves, what am I really doing? Like, am I really making a difference with my work, with the things that I do every day? And the consequences are real. I don't know if people have seen this slide. This is from a wonderful paper from the Mayo Clinic Proceedings that I'll share something on the next slide too. But the consequences of burnout aren't just having a bad day. If we look on the right-hand side, the professional consequences, we know that providers that rate high on burnout have increased errors. We know that they have decreased patient satisfaction, decreased productivity, and it costs, I think, at least $1 million to turn over providers within a healthcare system. And that's a lot. And then we look on the left, and the personal consequences are real. Relationship issues, alcohol and substance use, increased depression. We know we lose about 400 physicians at least a year to suicide, but the thousands of people that are suffering before that as well. So these are real issues that we need to think about. Drivers of burnout, and this is one, if there's one thing to look up and think about with me for a minute this morning, it's this, which is that the drivers are at all of these levels. The drivers are individual. There are work unit factors around how our EMRs and our work systems function or don't function well. There's our organization factors that will drive burnout. And then there's absolutely our national factors related to things like policy, insurers, and these issues. And so for people interested in this, again, this paper, it's the same one from the last slide. It's called 9 Organizational Strategies to Promote Engagement and Reduce Burnout. And they worked with hundreds and hundreds of people, and they interviewed them to figure out what are the real drivers of burnout. And these were the dimensions that they landed on. Which is, and again, think about your own day. Think about what your day looks like today. It's a Monday morning, it's early, it's snowy. What does your workload? I always call it my to-do list that never gets to done. Like it's just never done. Think about how much control and flexibility that you have. Clinicians obviously usually have much less flexibility than researchers that may be on the call or administrators. What's your work-life integration look like? People used to call it balance. There's really no balance. I mean, I have 3 teenagers at home, and there's no balance. You just try and figure out how to integrate this. Again, thinking about drivers of burnout, one of the things that came up is how much social support do you feel at your workplace? How much do you feel your organizational values line up or don't line up with your personal values? Efficiency and resources, how efficient or non-efficient are your work resources? And at the end of the day, one of the most important issues related to burnout in healthcare providers, this was physicians, I believe, specifically, was the meaning in work. Even if some of these were really tough, if at the end of the day, someone thought, I really believe so much, which I think many of us in academic medicine do, that this makes a difference, that it decreases burnout. And so as they looked at the paper, they spoke with hundreds of people, they thought for people by which these different dimensions are less optimal, we end up with more exhaustion, more cynicism, more inefficiency in the workplace. But also at the same time, if we can optimize these things in the middle, some of which we have more control over than others, we can get a more engaged workforce. Again, please feel free to cut me off, ask me questions, put things into the chat as we go. So many of you have probably heard about Don Berwick's triple aim. When we talked about improving the healthcare system, we had to focus on patient experience, population health, reducing cost. Annals of Family Medicine put out a paper in 2014 where they really talked about the quadruple aim, which is that provider satisfaction and really, I would say, well-being has to be at the core in order to really do the work that we do and to be able to do it well. So we're going to focus today at the individual level. Again, the work unit, the organizational level, and the national level cannot be underestimated and are probably where the majority of these drivers are. And so I want people to understand that while the work that I do and we're going to think about today is at the individual level, it's absolutely not the only fix and the only issue. But we're going to talk today about some strategies that we know can reduce stress and that we know have evidence to reduce burnout, but they are going to be at the individual level. For those of you that have heard of Tate Schoenfeld, he's now out at Stanford and he was the first chief wellness officer of a major health system. I looked at this actually recently, it was actually this weekend, preparing for today. And it's interesting, it's from 2021, but the way he talks about it is and he's really considered, I would say, the authority, if not one of the major authorities in the physician burnout, which again, in the nurse literature is called compassion fatigue. But most of his work has been in the physician space. And he talks about it like an 80-20 problem. And what he'll say is we need to not be training physicians and providers to tolerate a broken practice environment. So I wanted to put this in here again. And for him, the 80 is the organizational, the work unit issues. And the 20 is kind of more the personal resilience, which we're going to focus on today. But I think his work has evolved where he really believes that the focus has to be, which again, I think is part of his work in the chief wellness officer space, that we've got to make some major shifts at the organizational, work unit, and national level. So this is their model that they use when they talk about well-being and physician well-being. And they talk, if you look on the left here, that the premise is that promoting professional fulfillment and mitigating burnout really requires organization-wide change. This is not a problem that we can just fix on our own. And so the 3 areas that I come back to in my thinking and that may be helpful, maybe in some of your areas you're thinking about, is that if we can focus on a culture of wellness and doing this together as a group, if we can focus simultaneously on efficiency of practice, and at the same time, personal resilience, which we'll focus a little bit more on today. But if we can really do all three of those, we can end up with a more fulfilled and kind of hopefully a more well practice group and environment. So this term resilience gets thrown around a lot, and I'm a psychologist, so I like to put up definitions sometimes, but we'll see if this is interesting or helpful. So the resilience definition that I was certainly taught a while ago, and that maybe you all think about, if we were in person, I would ask someone in the audience, hey, how do you define resilience? And oftentimes people think about it as the process of adapting well, right, in the face of adversity, trauma, tragedy, or threats. But here's a definition that I like even better that I want to share with you from our colleagues Epstein and Krasner, where they say resilience is the ability to respond, but actually resilient individuals not only bounce back, but they actually grow stronger in the process. And I think you probably know people, maybe some of you on the call yourselves, but people that you know who you believe that this is true. And the reason I show the picture of the tree is, and there's probably people on the line that know more about trees than I do, but my understanding is when trees have experiences like this with this storm, where they really get bent over and they face adversity, when they come back to sort of standing straight up or whatever, they actually grow stronger in the process. Their root system gets deeper and they develop more strength. So I like this as kind of a visual, thinking about resilience, and as we think today about building our own resilience and that of our communities. And then for anyone who's really into kind of the neuroscience and the science piece, Stephen Southwick has written a really wonderful book called The Science of Resilience. And within it, he studies particular areas of a couple different groups of people that really have endured significant trauma. And at the end of his book, he basically says anyone can learn to become more resilient. Now, we all know that people have different baselines based on socioeconomic factors and different life experiences, but it's an interesting read for people who are interested in this concept particular. So I'm not going to describe the stress response. I know who I have on the call this morning, but I'll just have you think about it really in your own life and think about how I think it's an incredible system, because it's designed to enact immediately, as we know. As soon as there's a threat, the stress response kicks off. And it's also designed to shut off when the threat goes away. But again, if anybody has, let's see, anyone have one of these? Got a phone. I already said I have 3 teenagers at home. And again, if we were in person, I would ask you to raise your hand if you deal with one stress at a time in your life, because it's kind of how our system is built, right? And usually no one in the room raises their hand, because that's just not how we live, right? A stress at work happens, and then there's something at home, and then there's something with a parent or a child. And so as we think about building resilience this morning, we're talking about chronic stress, not acute. And what we know about the impact of chronic stress is that our brain simply isn't made to handle this. And so what we get when we have super high levels of our stress hormone and other things, what we get is, and not just we, but people we work with, atrophy in your hippocampus, so shrinkage in your hippocampus, you can't find your glasses, your phone, atrophy in prefrontal cortex, difficulty making decisions. These are real issues that it's not just kind of like pushing through them, we'll do okay. And again, our neuroscientists have helped us understand this a little bit more. And we also know this, right, that people that are under chronic stress are at increased risk for a host of increased negative health outcomes. And again, I'm asking us to think about this both in our own well-being today, yes, for our patients, our communities, but also for our colleagues around us, who I think endure. I would say that most of us work in a stressful environment. So at the beginning of this morning, I tried to paint the large picture in general and then come into healthcare space. And so as we think about this, and this is from our colleague, and again, if you're pulled into emails like many of us are, I invite you to watch this slide, because it took a medical student a week to build this slide. This is from our colleague Adi Hermati from Georgetown, and he's a physiologist by training. I work a lot with him, and so he talks about the importance of returning to baseline, and by that we mean physiologic baseline. How do we get that fight or flight response down? How do we get parasympathetic nervous system engaged, not just once during the day, but how do we actually do this? And so this slide, let's say Dr. Porter and Kara come to visit their Osher Center family in Cincinnati. I happen to be on the 4th floor of our medical sciences building. They decide to take the stairs. They're pretty in shape. And so they, their stress hormone, their heart's pumping, their fight or flight's kind of kicking in. They get to the 4th floor. And by the time they walk down the hallway to my office, their systems have kind of come back to baseline, right? But then let's say their flight was late, they didn't get in well, they slept late, or they had trouble sleeping. And I'm asking them to walk up those same set of stairs, and they've not slept quite their usual sleep at home. And so by the time they get to my office, that stress hormone hasn't quite come back yet, right? So they've got sort of a moderate level loss of resiliency. And then I say to them, hey, why don't you carry 50-pound weights in each hand, Kara and Dr. Porter, while you come up to see me? And by the time they get to my office, their stress hormone is still high, right? And this could be, again, think about in your own day. This could be by 7:30 in your morning if you've gotten up at 5 to work out or do other things. And so what are we thinking about here? The question is, how do we get here? This was the part that took a medical student a long time to build. How do we get ourselves here? How do we return to baseline, get our physiologic and our psychological space, but really our physiology down to baseline? And how do we do that multiple times a day, not just in the morning, maybe when you have time to work out, have a cup of coffee, do whatever, but how do we actually keep our physiologic system down to baseline throughout our day in order to avoid some of the consequences, the negative consequences of chronic stress? And I will say, I was giving this talk once to an incredible group of women leaders in Cincinnati. They're all the female, like CEOs, COOs, CFOs. It's some kind of underground now. I don't even remember their name, but it was a fantastic group of women, and it was out at a farm, actually Turner Farm, Kara. And it was over a happy hour, so they'd already had a glass of wine or two. And we got to this slide, and somebody in the front row yelled out, marijuana. And I was like, okay, whatever works to bring yourself down to baseline. No judgment in my body, but, think about really for yourself, what helps you return to baseline. And so everything we do at the Osher Center, I'll pivot for a minute, is to think about transforming primarily a system of disease and sick care to well care, which is, we all know on the call that what we eat, how we move, how we manage our stress or we don't, and how we connect with the world around us in nature, whether it be spiritual, religious, whatever your connection is. These are the foundations of wellness. They're backed in science. So we're talking a little bit more today as we talk about building resilience. We're focusing on the stress piece, and we're going to focus on mind, body, and mindfulness. But I want to be really clear that the bigger landscape is just as important to focus on all of these things, but we're just focusing a little bit this morning on the one element. Again, feel free to interrupt me with any questions, any comments, pop them into the chat as we go. So the concept of mind-body medicine is not new. It's based in many, many cultural traditions and historical roots. It's widely practiced in the US. So sometimes when I think about the mind-body medicine space, I think about the food as medicine space. I know we have someone on the call, I believe it's Whitney, that has trained with the College of Lifestyle Medicine, which maybe some of you have, that when the food is medicine kind of movement started coming into medicine, some of my dietitian colleagues were like, this is not new, people. Like, of course, food is medicine. So I want to be careful as we talk about mind-body medicine. These are old practices. This is not something new. There's, decades and decades of science and even hundreds of thousands of historical roots around these practices. But I think the science, particularly in the last 30 to 40 years, really is really robust around using mind-body practices with our patients, with ourselves, with our kids, to really, again, engage the parasympathetic nervous system, reduce blood pressure, improve pain, immune functioning, self-awareness. The data is very, very strong, which is why I bring it here this morning. And so when we think about mind-body techniques, again, I know this is not news to many of you, but yes, we're talking meditation, the use of imagery that a lot of athletes use for sure. Biofeedback, which some of you maybe use. Some of my colleagues use HeartMath a lot, where they'll, teach a patient relaxation practice and look at, for example, their heart rate variability and show them like, hey, you can really regulate this. Think about something relaxing, think about something stressful, and really teach people how to regulate. Autogenic training is well used in Europe, not as used as much in the United States that I know of. It's a little bit of a self-hypnosis where you'll say to yourself, my arms are heavy and warm, I am at peace, my arms are heavy and warm. You kind of repeat relaxing statements to yourself. Lots of breath techniques involved really in all of these. A lot of these techniques kind of cross over with each other. The importance of exercise and movement, yoga, tai chi, and then often, you can do these both in an individual or group-based setting, but these techniques are really robust. Journaling is a really wonderful one too. I usually put the definition from the NIH up here, just mostly to say to people who don't know about this portal as much, and maybe Kara's group has shared this a lot with you, but the NCCIH, so again, our NIH, as you know, has maybe, I think, 27, 28 institutes. If you are if you're a center, which we are, it just means you have a smaller budget. So it used to be called the National Center for Complementary and Alternative Medicine. Nothing alternative about it. And then we broadened out from medicine to health. But I put this up here mostly to show what their definition is and also to put the website. This is a great trusted portal if you ever have questions about any area, not just the mind-body area of integrative health. And again, I put this up here just to share. If we had time, I would do one of my favorite practices, which is a lemon imagery, where I'd invite you to imagine that you're in your kitchen. Maybe some of you are in this time of virtual learning. And I'd invite you to think about a beautiful lemon that's sitting on the cutting board. And then I invite you to cut the lemon in half. And then I invite you to smell it and bite into the lemon. And we teach this on day 2 of medical school here in Cincinnati. And then once you bite into that imaginary lemon, afterwards, we'll say to people what happened. And many, usually 50 to 60% of people in the audience will say they had that puckering, they kind of salivated. And the reason that we use this as an example is to say, this mind body is nothing new. It's based in science, that we are hardwired. And so what we'll do with the lemon imagery is we'll say, of course. So I invited you to think about a lemon. Maybe you hate lemons, you love lemons, you have an emotional response to lemons, but many of you remember that a lemon has a pH balance of, I don't know, it's like a 2 compared to 7, which is what we're used to. And so your mouth goes, oh my gosh, we have to get ready for this. And you salivate. And so we do this exercise early, again, to say we're hardwired. Our mind and our body are so hardwired and connected. So why not use that connection for stress reduction, for building resilience, for managing stressful events, for improving things like gratitude? Why not use this hardwired connection for well-being? And Kara, I can see there's things in the chat, but I can't see what they are. So feel free to.
There's a couple of really good comments, Sean, if you want me to read them, or do you want to wait till the end? Your choice.
Sure, I'm happy to go into them real quick.
Okay. So, a counselor from the EFAP program, here's all kinds of stress factors from practitioners. My colleagues and I find it interesting and baffling that the healthcare industry, who does this very research and seems in the know about these problems and costs to the well-being of our practitioners, yet the industry is not following the recommendations of its own research as a means of helping the workforce succeed at self-care. One example being a 12 to 16-hour shift. Just a thought, people are so exhausted with such demands, they cannot even do self-care on their off time, lack of sleep being a huge problem.
It's and Evie, thank you. And then I see several people agreed. It's absolutely ludicrous. I mean, the health, we should be leading in this, and we are so far behind. It's Kroger and GE and Safeway and Google and Aetna. It's our business partners that are actually looking at the science that we do in healthcare and implementing it, and we can't seem to get out of our way in the healthcare system. And I hate to add this statistic in there, but we spend 18.5% of our GDP in this country on healthcare, continue to get some of the worst health outcomes. If we could get out of our way, Evie and others, and invest in prevention, which is what we're talking about here today, and which is what many other business and corporate partners do, invest in prevention and actually take care of our workforce, we would do much, much better. And I agree. I'll show you a slide at the end, Evie, around a kind of a national group or some ideas, but I agree with you. It's a huge problem.
Yeah, and Sean Maloney, similar sentiment, you know, 4 days of patients, 1 admin day, people are chronically stressed. I think just in agreement with what you're saying.
It's ridiculous. It's really ridiculous. I think that, again, back to my earlier point, which is we're talking today a little bit about the individual story, but the fix really has to be at the organizational work unit policy level. It's going to happen there, because we can't meditate our way out of a really broken healthcare system and practice environment. That's my own personal belief, at least here. So we're talking about some of these practices here today, not to say it's going to fix those major structural organizational issues, and recognizing how severe that they are. And we're losing a lot of people. People are leaving the business in healthcare because it's too much. So thank you for your comments. Let me go back real quick here. Oh, so hardwired here. So some of you may or may not know this, but you know, if we think about the hardwire and some of the negative implications of chronic stress on our brain, one of the reasons we talk about mindfulness today is we also know that we can reverse some of those. So mindfulness-based stress reduction is kind of the most well-researched mindfulness program. John Kabat-Zinn. Still, I think some of the work we're focusing too much on the 8-week. But again, this is where a lot of the science is. And a lot of the science and the wonderful fMRI studies, Holzel's group, Sarah Lazar's group, Richie Davidson's group has done incredible work showing some of the actually sort of the neuroscience behind mindfulness training specifically, and how we can actually really strengthen those parts of our brain. Telomeres, people know about telomeres. Sometimes when I'm talking to a healthcare audience, so I have to explain it to you, but I talk about them like the little ends of the little caps on your shoelaces, kind of old-fashioned shoelaces. And we know that healthy aging begins with protecting your telomeres. What may not be as well known is that adopting yoga, mindfulness, lifestyle approach, that actually meditation, yoga, mindfulness meditation in particular, has been shown to increase length of telomeres and telomerase activity, which is really fantastic. So what we know is it's not just that it makes us feel good, but it can actually help with some of our brain sort of plasticity and change some of those parts of our brain associated with things like attention regulation, emotion regulation and control, but also can actually have a direct impact on our telomeres, which is great. And my hope is some of the data that I'll share today, you can then say, if somebody says, well, I don't have time for that, doc, or I don't have time to do this, you can share some of the science behind why we may want to think about it both personally and with the people that we work with. So again, not really a new concept group to the folks on the call today. Many of you have probably heard the definition of mindfulness. This is John Kabat-Zinn. It's not fancy. It's not clearing your mind and having a blank slate. That's ridiculous. That's never there. It's really an awareness that arises through paying attention in a very particular way on purpose, non-judgmentally to the present moment. I like a couple other definitions. One is it's setting the intention to pay attention with a certain attitude. And so, for example, what does this look like? You're home tonight with whoever it is. Maybe it's a spouse, maybe it's a child, a friend, somebody. You've had a busy day, and maybe the person's talking to you about their day, and you're not really listening because your mind is still going. You're still processing something that happened at work. And you might say to yourself, okay, for the next minute, I'm going to really set the intention to pay attention to what this person is saying to me and to really listen to it with a non-judgmental attitude. So it's really allowing yourself for 1 minute to really be a mindful listener and to really listen to what somebody's saying. And it can't happen necessarily all the time. The more you practice it, the more it will. The other definition I really love of mindfulness is it's the opposite of automatic pilot. How often still do we get home, we get to the grocery store, we get off a call or out of a conversation, and we think, like, what did that person just say? Or how did I get here? What am I doing? And really, it's because our minds are so busy. We're doing so many things. But can we dial into what's truly happening? How does our body feel? What are we thinking? What are we feeling? What are the sounds around me? And can we get out of automatic pilot to really come in to the present moment? And why, right? Why care about this in 2024? Why are we still talking about this? Well, why is that the science is so strong that mindfulness is one mind-body technique that we know can downregulate our nervous system. We know that it can return us to baseline, quite literally change the parts of our brain associated with stress. And I think about, for my own mindfulness practice, I think about it like a mental well-being. You know, how many of us on the call, on the line today, go to the gym, we work out, maybe we walk, we lift weights, something, but we take care of our physical well-being. Well, what do you do for your mental well-being? And some of you maybe have a prayer practice, a mindfulness practice, something. But I think about this like you would never just go to the gym and like lift weights for 6 weeks and then, or 8 weeks, because an 8-week program has been studied, and then you would be done. You go back because you have to continue to train. So this is a technique you can learn. It does need to be practiced in order to kind of keep it going. So I like to think about it like mental well-being training, just like we would train our bodies in kind of physical well-being. Again, I don't need to explain to this group the concept of what neuroplasticity is, but I will share a little bit of the data, this Sarah Lazar's group, that again, what we know what the prefrontal cortex does. We know what the amygdala is, the fight or flight center. What we know is that the amygdala shrinks again after many, many decades of science after 8 weeks. Most of the study again is on 8 weeks of a consistent practice. It's not a 5-minute, I forget what the United Airline, I think they have adopted the Calm app maybe. And we also know the connection between the amygdala and the amygdala and kind of the frontal cortex, prefrontal, it gets weaker. So the connections between the amygdala and the rest of the brain gets weaker, and the amygdala and the cortex gets stronger. And so what we can see again is after 8 weeks of practice, there's actually brain changes that are associated with things that we would think, oh, I see. That's why I'm able to be more responsive and less reactive. And this is really one of the goals. And I have to tell you, I don't have my own good story, but I'm going to share a story of my colleague who I think should be fine, our director of workplace mindfulness. She said she was rushing out the door one morning. She's got the dog, she's got the smoothie in hand. She's totally late for a presentation. And her husband, who was working from home that day, walks out in his cute little Ugg slippers and says, so they have a Keurig machine in their kitchen. And he's a very type A, likes everything in its place. He has labels on everything. And my colleague is not like that at all. And so every morning he wants Meriden to push the Keurig machine back in the corner after she makes her coffee. And that's just not what she does. She's this kind of get coffee cups in her car. And again, she would be fine that I'm telling you this story. And so he comes out this morning, she's rushing late, and he goes, hey, Mare, are you going to can you come back in and push the coffee machine back in the corner? And what came to her mind was a 4-letter word, because she wasn't going to do that. But she didn't say that because she practices mindfulness a lot, has for about 20 years. But immediately her amygdala fired and she thought, okay, I'm going to say something really unpleasant. But she paused and instead she said, no, babe, I'm not. Have a great day. Same response. Or same response back to what he wanted, but a different delivery, right? She could have said a 4-letter word and the day would have unraveled and they would have had a fight. But with her mindfulness practice, she was able to notice, oh my gosh, I'm in fight or flight, but I'm going to pause and I'm going to respond the way I want to respond rather than reacting. And so it's just one example. I think it's a funny story. You have to know her and her husband as well. But benefits of mindfulness, we talk about it because the benefits are enormous. Better immune functioning, overall well-being, working memory, awareness, information processing. We work with a lot with corporate partners, and then they actually pay for our work with our not-for-profit partners on things like focus and productivity. I mean, who doesn't want that more so that they can then come home to their loved ones? But the benefits are enormous for people that really sort of adopt a regular practice. And then the organizational benefits. So Google Google onboards every new employee with 8 weeks of mindfulness training. Aetna, the insurance company, actually has a chief mindfulness officer. And why? As some people, mentioned into the chat, because the science shows that organizationally, these are the things that we get if we invest in kind of a more mindful workforce. We get enhanced focus, decreased conflict, creative thinking, compassionate leadership, decreased healthcare costs. So Aetna saw an 11-to-1 return on investment by training all of their employees. Maybe we could just get our healthcare partners to adopt some of this. I'm looking at my time. I'm going to go through a couple studies and some resource, but I want to really do a practice this morning. But this was published in Lancet. This was over 15 trials. It was back in 2016, but I think it's important. This was looking at interventions to prevent and reduce burnout. And what they found at the time was that most commonly, the studies were mindfulness, stress management. They were small groups, and that the results suggested that the strategies could be effective to reducing burnout. Again, not going to fix the organizational issues that we've talked about. Then this was another study by Krasner and Epstein looking at primary care physicians, and they took a group of 70 actually PCPs who rated specifically high on burnout, and they did basically this intervention. You can see it's pretty hefty. So it's 2.5 hours a week. This is what John Kabat-Zinn's program is. Each session had kind of some formal practice within it, and then some experiential practice and some exercises as part of it. And what they found was that improved well-being and mood, improvements in mindfulness were associated with increased empathy and reduced burnout. I just show you this to show you that there is data to suggest if we can put some programs into place. And this was a group that said, well, these are busy primary care clinicians. We don't have 8 sessions. What if we did it with 4? And in fact, they found that an abbreviated mindfulness training course was also associated with reductions in some of these outcomes. So I think hopefully I've made the case a little bit that although rates of stress are high, practicing mindfulness is one thing that can reduce burnout, increase empathy. It's not going to fix the problems that we have, but there's very good data to suggest in the general public, as well as within the healthcare space, if we can implement some of these things and some of these practices and really build them into our daily lives, that we can do better. So 8:41, I'm going to invite a practice. So just 3 minutes. So I invite you to, I think your videos are off, but try and put down your phones just for 3 minutes if you can, and just find stillness for about 3 minutes. Just an open invitation here for your own well-being this morning. So settling into kind of a comfortable place, whatever that is for you, putting your phone down if that's possible, your screens, closing eyes if that's available to you. If not, just a soft gaze downward. And just really turning your attention to what is right now. Maybe this is the first moment you found stillness since you woke up this morning. And just noticing what sounds are around you. Notice, how does your physical body feel this morning? Notice what thoughts you're having this morning. Maybe take note of emotions. It's almost like you're taking an inventory, just doing a brief check-in of where you are right now. No good, no bad, no right or wrong. You might just say to yourself, whatever I'm feeling already here, let me just experience it for a moment. And now gently turning your attention to see if you can put all of your focus and awareness. That's what a mindfulness practice is. It's a focused awareness practice. See if you can bring all of your focus to your breath. If your breath isn't comfortable this morning, choose something else that's consistent, a sound, a word, something you're looking at. If it is your breath, see if you can really just notice the feelings of your inhalations and your exhalations. Maybe noticing the rise and fall of the abdomen. The cool air moving in and out of your nostrils. And when your mind wanders, which it will because you're human, just gently, with no judgment, see if you can come back to your breath, back to the focus of whatever you're focusing on. And just keep coming back again and again and again. And then in this final moment, see if you can become aware of your entire being. Just really seeing if you can sense your full being this morning. Maybe starting with the breath down at the toes, watching the breath as it moves up your legs, into your hips, your torso, your chest, neck, and out the top of your head. And maybe allowing just a few more deeper inhales, a few more deeper exhales. And then slowly and gently returning back into whatever space you're in. Maybe a shoulder roll or a neck roll. Maybe blinking eyes open if they were closed. Coming back. And if we were in person, I would invite you to put into the chat, how was that? Easy, difficult? How do you feel? Maybe just one word. I invite people to just put into the chat if they're available. Just one word of how you feel. Distracted, tired, relaxed. Great, Lisa. Sometimes hard to drop in quickly. Calm, Sarah, thank you. Grateful. Thanks, Whitney. Aware. Yep. Reset. Great. Helpful. Yeah, I need that through the day also, Gita. Refreshed. You're welcome. More centered. Easy. Oh, easy. Great, Jacqueline. Refreshed. Anybody find it difficult? Anyone feel more agitated? Focused. As we know that it can be difficult, particularly to try and drop into a quick practice, like, okay, quickly focus and then come back out. What we also know is the more we do it, the more we practice, the more we can do that when we need to. We're going into a difficult conversation with a patient, with a loved one, with a family member, with somebody, and we can take just 30 seconds, put the hand on the door, and right before you walk in the door, or right before you're in your car and you come home, just taking 1 minute. You don't have to meditate for 20 minutes or 30 minutes to get the benefit, 60 seconds. And so briefly in our time, I'm being mindful of time. This is our wonderful colleague, Mira Murthy, who does mindfulness down at our Free Store Food Bank here in Cincinnati. But how do we cultivate briefly? So we know that a formal practice, things like when people think about a meditation practice or mindfulness practice, oh, I have to sit like Mira here and I have to be seated meditation. And if that works for you, wonderful. But we also know that the benefits that I showed you earlier are just as strong from informal mindfulness. Taking a mindful walk where you're just walking. You're not listening to a podcast. You're not processing your day. You're focusing on what you see, what you hear, what you smell, what your body feels like walking. Mindful teeth brushing or showering. Next time you take a shower, brush your teeth, try and just for like 1 minute, just do that. Notice the smells, the sounds, the feelings, because oftentimes our minds are racing, and that's okay. But the more we train our brains to come back to just teeth brushing, just showering, the more we can cultivate that present moment awareness for when we really need it in our lives. And so additionally here, just some ideas of practicing. You can practice present moment awareness in the line, sitting at the car, sitting at a red light within your car. You can block and break. Someone on the chat said they need that throughout their day. Wonderful. Put it on your phone, put it into your computer. Use some of the technology that we have to just give yourself 1 minute to just breathe, to just reset, as some of you said, and come back to baseline. lead a mindful minute before a meeting, and you can call it intention setting. You can call it whatever you want. But before you start some type of a meeting, say, we're going to take 1 minute and just land here together. Leave behind the stuff that's come before, because too often we come into meetings and we're so distracted with all these other things. So you can do this within your own setting. I'm sure that your Osher Center there, and certainly we have examples if you'd like something sent to you. Eating mindfully, listening mindfully. We talked about noticing the transitions, walking. Oftentimes I certainly hold a lot of tension in my shoulders, but notice throughout the day a couple of times, am I clenching my jaw? Am I tightening my shoulders? My mindfulness practice has actually been most helpful with my neck and back issues, because I've started to notice much more when I'm just holding very, very small amount, but what it's ended up with is some serious kind of neck issues. So just noticing for yourself, am I clenching? Can I do mundane tasks with awareness? Can I single task? If you're trying to think, I don't have time, how do I do some of this? Habit chunks. So you could take teeth brushing, so something that you do every day, and just add 60 seconds of a breath practice onto that. So put it next to it, something that you already do in order to start. And so then again, briefly, pick a time. If you actually want to develop a practice of your own, like a seated practice, pick a time when you won't be interrupted. If you need, put a sign on your door saying, I'm busy for 5 minutes. No one has to know what you're doing. Be consistent. Meditation and mindfulness practice, just like I talked about working out physically, it's most beneficial when you do it regularly. Even if it's 60 seconds a day, that's fine. You'll see the benefits. Really, it's most effective, like with any habit. And if you forget one day, be gentle on yourself and come back and try it on another day. Some people can't stand sitting still, forget it. Some people really want to, but there's so many different types of practice that you can do. Try something, or again, for your patients, for your loved ones around you. So I'm going to wrap up. I want to open up for questions. These are just a few things that we do here at Cincinnati, our mind body medicine training. We've got kind of wellness rooms. I'm sure that you have some of these, hopefully within your work site. We have adopted this mind body program. Actually, it was from Georgetown originally, and certainly found that for the students we've worked with and faculty and staff, that implementing the same kind of data I showed you earlier, small groups, focused on learning some of these mind-body practices, sharing in a group, have improved outcomes of our students and of our faculty. We run a faculty training in this. If anybody's ever interested, please let me know. We do this twice a year, just kind of off in kind of beautiful Amish country here in Ohio. Resources, the ones I want to highlight here, Insight Timer is my favorite app that I recommend. I'm sure you have ones that you like, but I like that because you can edit like 2 minutes, 5 minutes. I have 10 minutes. It's for anger, it's for sleep, it's for anxiety. Mindful.org has great resources. And this is my favorite book, Jon Kabat-Zinn's Wherever You Go, There You Are. If you're interested in these concepts, or someone is, it's really wonderful, super easy read. It's not onerous at all, but it's really nice. I'm going to land with just a couple of these here. Tate Shanafelt, the colleague the person I told you who's really sort of one of the leaders in physician well-being. He runs a chief wellness officer training out in California at Stanford. I think it's about a $10,000 investment. So people have to, what people are doing are they're getting their systems to invest. But for people that are interested in this level, and then also the Mayo Clinic has some really wonderful resources on their website. Again, a lot of the work I think that these folks are doing are really at the organizational level, which I think is critical. National Academy of Medicine has great resources here for clinician well-being and resilience. They're very practical to help practices and people think about implementing. The AAMC has a lot of resources also about specifically well-being in academic medicine. So I just want to leave you with those few resources. I want to close up and open up for questions. This is our sort of scanner code for our Osher Center. We're happy to connect in any way that's helpful. So thank you all for your time on this post-Oscar snowy, post-time change morning. So I'll open it up to any questions, comments. Feel free to unmute yourself or put it in the chat.
Thank you so much, Sean. Looks like Lisa has a question.
Sorry, I'm just taking myself off mute. Good morning. Thank you
Hi,
for
Lisa.
speaking.
Sure.
Good morning. Hi. Can you hear me?
Yep.
Okay. Okay. Thanks for speaking. You brought up I'm a yoga teacher. I've been teaching meditation for 20 years, and I'm at UVM for Integrative Health and Wellness Coaching. And I'm
Nice.
actually in a class for the science and evidence of integrated health right now. So
Nice.
one thing I found, I've been studying, it's funny, what you say is so true, because I always explain it like the gym meditation, because I got lucky enough to practice just when I was in a great state 20 years ago, and I'm certified in yoga and meditation. I teach it. But now that things are like have become rougher in my life 20 years later, I definitely know I'm more like protected from doing meditation all these years, like my energy and all the breathing, the pranayama and everything. And it's funny because when I was researching to find long-term effects of meditation, because I know I have it, even reduced blood pressure, all these other things, I found short-term effects. It was hard for me to find the research on the long-lasting effects. But like you say, it's like a practice, like, and you build it up, and over time, it's just something that stays with you. Something I'm trying now too is vagal nerve stimulation. I find that's very helpful for emotional regulation. And some transcendental meditation where you just repeat a mantra, and it's good for sleeping. You repeat a mantra, and it could be anything like Sanskrit or I am love. I need to go to sleep. It takes your mind away from thinking about anything else, and it really helps the mind calm down and relax.
Yep. Yep.
And one thing I was thinking about too, with the body registering, myself and people I know with trauma, they hold their trauma like behind their heart chakra, and they don't breathe fully. So another thing to be aware is like where you're breathing into where you're holding your stress, like you were saying. But one thing I do struggle with, and I think maybe anybody maybe that's an empath or energy worker or something, I find that I absorb a lot of people's trauma when I work with people that have trauma. And that's something, it's not like the stress of coming into it. It's like leaving the session and feeling all their pain. And that's the thing for me, like I've been trying to be aware of, but hard. I don't know if a lot of doctors suffer with that as well. I would think so.
Yeah, I think that's a real issue for any clinician, any of us that work in high trauma settings, is how do we create that sort of bubble around us in a way that we're still connected to the people that we're with, and at the same time kind of protecting as we need to our own well-being in our own space. So thank you, Lisa, for sharing.
Thank you.
I see Laura's hand up this morning.
Thank you so much, Sian. It's so what a fabulous talk. This is an area near and dear to my heart. And I was just curious about your reflections on an institution or organization that maybe in its infancy or early stages in the AMA kind of steps to organizational approaches to wellness. So, and strategies for those of us in leadership or just day-to-day clinical work, in addition to the individual mindfulness practice. How can we advocate for additional change at the organizational level?
Yeah, it's a great question, Laura. And I would say in Cincinnati, we're certainly not, we're at the early stages as well. I think it's like with anything, right? Any kind of change that we're trying to make, it's figuring out, and I don't know your role within the system, Laura, but it's figuring out who are those kind of executive level champions. It's getting a core group of people together so that people realize, if it's one person, it's somebody's initiative, if it's two, but if it's three or more, and if we go across departments, across colleges, across, kind of different silos. So I think it's just like with any change. I do think probably Shanafelt's program, I haven't taken it myself, has some kind of coaching and mentoring along the way, but I would say it's like with anything. It's getting a core group of people. It's starting to get the attention of the leaders. It's, as we said earlier on the call, we can show the leadership the cost benefit and the analysis, and still getting people to invest in prevention is hard work. So I wish I had a great answer for you, except to say, keep going and keep reaching out and finding the other people that are interested. And the more we continue to push the needle, it's got to happen because we have to do it, right? Good morning, Dr. Porter. Anything else in the chat, Kara, for us to?
Yeah, there's a question from Martha. she'd love to hear more about designing a wellness resource room. She works for the Honors College and wants to.
Oh, so
create
it
one.
was a pretty, it wasn't, Martha, it was probably maybe $2,500. It was really identifying the room and figuring out how we could get whatever room. This room happens to be in our medical school on the first floor, and then getting a little bit of investment for someone to, I think we put a massage chair in, which is probably the biggest investment. And then we put some meditations and some aromatherapy. And now the hardest part, honestly, was just getting the students started to go in for like hours at a time. So now there's like a sort of a sign up thing for the students. So and instead of an hour, they can go in for 30-minute blocks. The medical school student affairs runs that. But I think creating these respite rooms, not too hard. And then it's really creating the system by which people can sign up so that there's accessibility for multiple people. But people have loved it. The students love it.
I also want to just say in our last minute here together, there's a bunch of folks from EFAP, Evie Smith being one of them, and they have some mindfulness offerings, 12 to 12:30 via Zoom on the 2nd and 4th Fridays. So anyway, I just wanted people to be aware of that as something happening right here for employees.
Well, I know we're at 9 o'clock. Kara, Dr. Porter, others on the call, thank you so much for the invitation. Again, I hope we did Laura Mann justice this morning, honoring her, and wish everyone a great day, great week ahead.
Thank you, Sean.
Thank you so much.
Thank you, Sean. That was much appreciated.
Of course, come see us in Cincinnati anytime. We're your other Osher Center. Come find us. We're here.
Have a great
Thanks,
day.
Kara.